Hey GP learners! The Pomodoro technique is a method of improving your productivity. It's a really simple premise that provides urgency and focus in terms of the work that you're doing. And it works on the basis that you spend 25 dedicated minutes on a particular task and then you simply take a 5-minute leisure break. Sounds simple, but trying to focus on particular tasks for that length of time means that hopefully you will get the task completed and effectively done. There's loads of different ways you can do this. There are actual dedicated Pomodoro timers, and for yourself I've created one that may help. But how can we apply this in primary care? Well, when consulting with patients it can be a little bit more of a challenge because that time frame is quite significant, but as we have more complicated patients that we are having to spend more and more time with, potentially spending 20 minutes consulting with the patient, 5 minutes working on the administrative element of things, and then a 5-minute leisure break may help to improve the productivity of that clinician throughout the entire day because they will remain refreshed and focused on the work that they do. However, one of the clear benefits of the Pomodoro technique is actually with the administrative work that we're having to do in practice. So for example, having one block where you're spending doing your administrative stuff like blood results, letters, that kind of stuff, and then having another 25-minute block, for example, your reports and that kind of work, focusing that particular task in that time frame, and maybe even a 25-minute block where you're focusing on your appraisal and revalidation work. I know, foreign concept, but it may work and mean that you're more focused and able to complete the tasks that you need to do in those time frames. But it'd be nice to have a tool to help you. Well, in order to help you, I've created my own Pomodoro technique primary care timer, and it's simply the opportunity to work with me. It's available here, and you can access it anytime you want through YouTube, and simply you just work with me in the background, because having somebody working with you potentially can be really useful. This is one of the techniques I show you that you can use in terms of improving your productivity in primary care, and feel free to check out my video that talks about this in more detail here. Hope you found this useful. As always, EGP learners, feel free to contact me any comments or questions, more than happy to help. Make sure you subscribe, and as always, EGP Learning is here to help save you and your patients time by tech enhancing your primary care and learning. Catch you in the next episode.